Welcome to Sex Ed with DB. I'm your host, DB. Let's get into it. Here's a fact that you may not know. Nearly 3 out of 4 women or people with vulvas experience pain during sex at some point. I have been one of them. And while the causes can vary, one thing that consistently makes a difference for me is Uberlube. It's silicone-based, doctor-recommended, and designed with sensitive bodies in mind. It lasts long, it's never sticky, and doesn't stain my clothes or sheets. It's the one lube I always keep within reach. Seriously, I have 3 bottles in my bathroom cabinet right now. If you're looking to bring more comfort and pleasure into your sex life, try Uberlube and use code SEXEDWITHDB for 10% off at uberlube.com. What if we rethink pleasure as self-care? I recently led a study with 1,000 participants to explore how daily magic wand use impacts things like stress, relationship connectivity, sleep, and emotional well-being. The results? Pleasure is powerful medicine, and vibrators like the magic wand are legitimate tools for wellness. Want to see what we learned? Go to magicwandstudy.com to explore the findings and start your own journey to more mindful pleasure. Hello, DB here, your favorite sex educator and pleasure expert. Let's dive right into DB's pleasure preview, where I give you a little taste of what we're diving into today, what the science has to say, and how it might just change the way you think about sex. This week's episode is a special one. We are diving into something that might actually surprise you, ketamine-assisted therapy, and how it's helping people tap into deeper intimacy, emotional freedom, and yes, pleasure. So here's the scoop. Ketamine is a dissociative anesthetic, and in low doses, it works on the brain's NMDA receptor to quiet overactive neural circuits tied to depression, anxiety, and PTSD. A 2014 study published in Neuropsychiatric Disease and Treatment found that ketamine can reduce depressive symptoms in as little as a few hours, especially in people who haven't responded to other treatments. This is something we talk about today. But that's not all. Ketamine also boosts neuroplasticity, your brain's ability to form new pathways. A 2018 review in the Harvard Review of Psychiatry called this one of ketamine's most exciting potentials for long-term healing, especially for folks stuck in looping thoughts or trauma responses. So, what does this all have to do with pleasure? A 2019 study in the Journal of Psychoactive Drugs found that patients receiving ketamine-assisted psychotherapy reported increased connections to their bodies, heightened emotional insight, and more capacity for intimacy. Another paper from Biological Psychiatry described how ketamine can increase feelings of empathy and emotional closeness, 2 major building blocks for intimacy and sexual connection. And we're here to learn all about that and more from this week's guest, Dr. Genesee Herzberg. Dr. Herzberg is on the cutting edge of this work. She's a clinical psychologist and co-founder of Sage Integrative Health, where she and her team are exploring how ketamine-assisted therapy can help people heal trauma, deepen their relationships, and reclaim their joy and pleasure. If you've ever felt shut down, disconnected, or like you're just going through the motions when it comes to intimacy, this one is for you. Here I am with Dr. Genesee Herzberg. Hello, Dr. Genesee Herzberg. How are you doing today?
Hi, Danielle. I'm doing well. Thank you. And yeah, you can just call me Genesee.
Oh, great. Now we're already friends. Genesee, I'm really happy to have you here today to talk about something that we've actually never in nearly 300 episodes of the podcast talked about, which is ketamine and pleasure. So I'm really happy to have you as an expert in this field to really educate me and all my beautiful listeners about this topic. But before we dive in, we're going to start with our first segment, the quick and dirty. So the quick and dirty is our rapid fire segment where we get to know our expert with bold questions, honest answers, and just enough spice. In this case, there might be a little less spice than usual. But I would love to know first and foremost, what is the biggest myth that you'd like to bust about ketamine therapy?
Yeah, thanks, Danielle. And just quickly saying that I'm honored to be here. Thanks so much for having me, and how fun to
Yeah.
get to introduce a new topic to your listeners.
Yes.
So, in terms of myths, I think I would maybe go two directions. One is that it is highly addictive and liable to cause deaths like Michael Perry's. That's been blowing up in the media recently. And when used in a clinical or therapeutic setting, it very, very, very rarely leads to any form of misuse. And a death like that is clearly coming from someone who has a long history of addiction and other issues. So that's on the one side. And then on the other side is the myth that it's a quick fix and that you're going to immediately get better after one session. That's been going around a lot, this kind of myth of the magic pill in psychedelic therapy in general. And what we've found is that it often takes multiple sessions and psychotherapy to benefit from lasting results.
Yeah, super important to start there. And I feel like, most people maybe who clicked on this episode, I feel like Matthew Perry is probably the first image that like comes into people's minds of like Matthew Perry equals ketamine overdose. And I think it's so important to get the record straight from someone who uses ketamine therapy, in your practice and who is an expert in this field. It's really critical for us as the lay people to hear this. So thank you for making that clear.
Of course.
Yeah. What's one thing that you wish everyone knew about their brain and pleasure?
I wish that everyone knew that it's easy for the brain, particularly over time, to get caught in repetitive thought patterns and to start firing in the same pathways again and again. And so, novel experience can be incredibly helpful in pulling people out of challenging states and into places where they can better access pleasure and joy.
Yeah, that's a really good one. I feel like as a sex educator, I'm constantly trying to express to people that like getting out of your routine like requires a little bit of effort, whether it's just like writing down like five things that you want to try and pulling one out of a hat once a month and just like
Yes.
seeing how that goes, or going to a different place like on your walk, or like just really doing anything that's out of the norm can really help kind of solidify this idea that novel experiences are a little bit scary and therefore exciting, and therefore that can lead, if it's safe, of course, to pleasurable experiences.
Absolutely.
Yeah. Um, what is a favorite pleasure practice of yours, big or small, in your clinical settings?
When you asked that before you said clinical settings, I immediately went to walking outside in the forest. For me
Yes.
personally, that's just, the thing that consistently pulls me out of any challenging place that I'm in and brings me in contact with my sense of aliveness, of pleasure, of connection with myself and with the world around me. And so it's
Mm.
something that I encourage clients to do. And some people even do outdoor nature therapy or ecotherapy as part of their work. There's just so much novelty in connecting with nature, and so much potential to find oneself and find one's joy.
Yes, that's so, so important. I feel like we don't do that enough, right? Like we're not, I think like at this point with like working from home or doing an office job, it can be really challenging if someone has a commute every day to actually find time to connect with nature.
Totally. Yeah. I mean, I find myself going sometimes a full week without really spending time outside. And, I
Yeah.
have to remind myself, just get out for, 15 minutes in the morning or a short walk after work or whatever it is. It makes such a difference.
Yeah, I mean, talk about like, changing up your routine and getting out of a thought pattern. If you're kind of spiraling on something, it's just like actually just go for a walk and like put on 10 minutes of your favorite music, and like
Yes.
you will be in a different headspace most likely, even if it's just a
Hmm.
tiny bit different. Um The last question we have for the quick and dirty is, what's one way that ketamine has changed how you understand intimacy or how you teach about intimacy?
So, one thing I've witnessed in both myself and in my clients is that ketamine seems to open up the kind of barriers between inner and outer, allowing us to connect more deeply with ourselves and with others. So, it softens the defenses, and it's also increases the neuroconnectivity between the limbic system, which is where we process our emotions, and the prefrontal cortex, which is where our executive functioning happens. We make decisions, planning, etc. And so another way of saying that is it softens the barrier between the conscious and unconscious minds. So that immediately gives us a sense of intimacy with ourselves. And then it can also allow us to speak more authentically with whoever it is that we're with, whether it's a therapist or with a friend or with a partner.
Yeah. Wow. Okay. So I'm really excited to back the truck up now because I feel like, myself included, before I contacted you, I knew very little about ketamine. And just anecdotally, I know that, people use it kind of as a party drug and people use it, when they're hanging out with friends. And I feel like, especially, we both live in the Bay Area, it's a very popular conversation, just like between pals, not in a
Mm.
clinical setting. But you, as a clinical psychologist and someone who uses this clinically as a doctor and as an expert, you have this, wealth of knowledge and experience of what it's like to, administer this as an expert in a clinical setting. And so I'm really excited to have you on to kind of do a deep dive here about like what ketamine is, like how we can connect it with what it looks like to have pleasure, and in terms of like the way that people view their bodies and their senses when it comes to, engaging in ketamine assisted therapy.
Yeah.
And before we even do that, we got to know, what is ketamine? How does it work in the brain and the body from a scientific and therapeutic perspective?
So, ketamine is what's called a dissociative anesthetic or a dissociative psychedelic. It is a medicine that is widely used in the Western and non Western worlds. And it's on the World Health Organization's list of essential medicines because
Wow.
it can be so helpful for everything from on the battlefield, where it's quickly absorbed within the system and can be used as an anesthetic before a surgery that needs to happen right then and there, to surgery with children, to the immediately prior to inducing other anesthetics. It can be supportive as sort of an intermediary. So it's used all over the place in medicine. And more recently, it's been used in mental health as well. And it's been found that it helps people with treatment resistant depression. So people who have tried several other modalities, usually including a medication trial and potentially therapy alone as well, and none of that's worked. And about 50% of people who fall into that category end up being helped by ketamine therapy. So it's
Wow.
one of the most effective treatments out there.
50%.
Hmm.
Quite high.
Yeah. It's pretty amazing the ways that it can help people when used in a clinical setting. And it's one of the reasons I think that people end up using it recreationally and sometimes abusing it as well, because it really can shift people out of a very stuck place into a place that's much more um, open and joyful. So it has an impact on mood, on cognition, on memory, on learning. It works primarily with the neurotransmitter glutamate, which is the most common neurotransmitter in the brain. And it impacts all kinds of different systems in the body and brain, to the point that we don't even know everything that it does. But it's a very impactful neurotransmitter. And in kind of therapeutic or psychological terms, what that translates to is often an almost immediate decrease in anxiety and depression, a lifting of the mood, also, and the impact can differ quite a bit depending on whether you're doing a lower dose or a higher dose. So I'll start off talking primarily about the lower dose here, which is what we use in what's called psycholytic psychotherapy. So in a ketamine assisted therapy session where the client is still able to communicate with the therapist and talking with them throughout most of the session, sharing what their experience is, processing what's coming up. So in those states, people often find that, as I mentioned earlier, their defenses are softened. It's easier to access subconscious material. It also is common for it to kind of turn down the volume on both physical and emotional pain. And that can help it to serve as what I call a reassociative, which means that it helps people to connect to memories and trauma and emotions that were previously dissociated. So previously pushed away and out of the psyche because they were too much to handle in the moment of a traumatic experience. People are then able to access them in their ketamine session and then work with and process them. And it also interrupts thought loops or traditional thought patterns and can provide a new perspective, deeper insight, better understanding of things that are happening in one's life.
Wow. So it can do a lot here. Just to recap here. So people who are like have depression and, other forms of therapy or medication, it hasn't worked, but it improves depressive symptoms 50% for 50% of people, right? Is that
Mm-hmm.
essentially okay? So we have that category. Then we have the let down the defenses, right? So that more people can find joy and kind of less anxiety from this. And could you explain one more time how it works in terms of the neurotransmitter? I think I'm in science class right now and I want to understand. So how exactly does glutamate like how does it relate to it?
So glutamate does a lot of things, and there isn't a one-to-one understanding. In fact, the brain is such a black box that most of these understandings of what's happening in the brain are actually purely theoretical. So
Wow.
I'll tell you what we think is happening. We can kind of look at animal brains and understand a little bit that may translate to human brains. It may not, but we're not, dissecting human brains while they're live and on ketamine. So we don't really have access to this information in the same way. But one of the things that it does is it increases, I don't even think I mentioned this before, but neuroplasticity. So
Mm,
both neural growth and connection between neurons. And so that can be a piece of what allows greater access to different parts of the brain that we typically don't have access to. And
mm.
then it also impacts things like mood and cognition and learning and memory. And so that
Right.
may be a piece of it as well.
Right. Okay. So there's that. So I'm thinking about these three buckets, right? There's like kind of
Mm-hmm.
the depression kind of bucket. There's the like mood bucket, just in general, of like
Mm-hmm.
joy, less anxiety, kind of that increase of neuroplasticity, ability to learn, connect. And then there's this kind of third bucket around like trauma, stress, about being able to kind of like it's a disassociative, but it's a re-associative in this way of maybe being able to re-access some of these things that have happened to us in our past if we're engaging with ketamine.
Yes, that's right. And I didn't even mention the higher dose impacts. And the one thing I'll say about that, because there's a lot we could get into there, but at higher doses, but still higher doses that are used within a therapeutic setting, this is where it becomes a real dissociative. So people no longer really experience their bodies. They may have a harder time communicating. And they tend to experience something called ego disillusion, which means they're no longer really connected to their sense of self. And often people in this state will instead connect with something larger than them. Often it feels like they're, connecting into a greater source of consciousness. And when done in groups, people often feel that they're merging together, their consciousnesses are merging together. Often people have mystical experiences in that kind of state. So those higher dose experiences can be incredibly powerful and healing for people, sometimes just in a single session.
Yeah. Is this also, could we, for the layperson who's heard of the phrase K-hole, is this kind
Mm-hmm.
of a higher dose experience of someone going into a quote unquote K-hole and then feeling like, oh, I like actually, yeah, don't feel like I am myself. Like, is that kind of what happens in a K-hole?
It is. It is. So it's the same experience, but the big difference there is the set and setting. So a K-hole in a therapeutic setting where you're, being supported by a guide or a therapist who's right there with you the whole time. You are prepared. You know what you're getting into. You know that you're stepping into that kind of state. Allows for the experience for people to completely surrender to the experience. Where in a party setting, often people end up in a K-hole without intending it. And so that can
Right.
be really scary and disorganizing.
Right. It's the difference between like I signed up for this.
Yes,
I have consented to do this and to explore this part of myself versus this is an accident or I took too much or I don't have like the proper, senses that are going on for me to really experience this in a way that I want to.
exactly.
Yeah. Okay. And the last, like, kind of sub question I have under this before we continue is how does this work? Like, say a patient is curious about something like this, like, finds Sage, they live in the Bay, say, and they find your practice. And what's kind of like the quick process of like how you would assess how many sessions, what that really looks like for somebody, like how to assess someone's goals with going through that. And then we're going to kind of bring it together about sexuality and pleasure in just a hot second.
Great. Yeah. Yeah. So if someone reaches out to Sage interested in ketamine therapy, they would first speak to our patient care coordinator who would think with them about what it is that they're dealing with and which of our services might be helpful. It could be that they work with a psychotherapist for some time and then step into ketamine work. It could be that they step right into ketamine assisted therapy with just a few prep sessions. Or it could be that they also work with one of our other integrative practitioners, either in addition to a psychotherapist, or we have some people who do what we call integrative ketamine assisted therapy, where they're working with a body worker or craniosacral practitioner as their ketamine guide.
Hmm.
So that's for someone who really wants to kind of move into their body. And we can talk more about that later if you
We
like.
sure will.
So yeah, they'll talk with the patient care coordinator. The patient care coordinator will match them with the appropriate practitioners, and then they'll start meeting with their guide or their therapist to begin the preparation phase. And that can, like I said, it can just be a few sessions, or it can extend for months or even years, depending on the person, what their goals are, what their level of trauma is. We find that when people have pretty extensive early experiences of trauma, it's helpful to have a longer prep phase. And also their comfort with the therapist. It's really important to develop a safe and trusting relationship with the therapist before stepping into these vulnerable states with them. So they'll decide together how long they want the prep phase to be. Sometimes it's actually just a matter of feeling it out. And eventually the client will say, okay, I think I'm ready.
Hmm.
They'll meet with a psychiatric practitioner or prescriber to then prescribe the ketamine if it's appropriate for them. And then they'll step into their ketamine session, which is generally about 3 hours
Wow.
with the therapist present throughout. They'll have another integration session or two after that. And some people will have a number of integration sessions and they'll really feel like that first session was a lot and I want to continue to integrate it and implement the learnings into my life. And others, especially those who really benefit from the biochemical effects, like for some people, about 50% of those with treatment resistant depression, they just have a mood shift right away. And for them, it
Wow.
can be helpful to have more frequent sessions early on to benefit from the compounding effect, where more sessions within the first few months can help the ketamine, the mood lifting impact of ketamine to last longer.
Wow.
Where others really just benefit from the psychological process that happens with the ketamine on board, like we've been talking about. And in that case, sometimes a longer integration phase is better and they'll space out their ketamine sessions more. So maybe once a month or once every couple months, something like that.
Wow, this is so fascinating, Genesee. I'm really, really into this. Thank you for laying out the land for us. Now let's kind of transition to what we're like here to really deeply talk through, which is how this kind of connects to the body and pleasure and intimacy. And so I'm wondering, like, now that we kind of know like the process here and maybe what it does to the brain and how it can help people, how do you think that ketamine assisted therapy can help people reconnect or connect with their bodies, especially when it comes to pleasure, intimacy, and sexuality?
Yeah. So I mentioned this reassociative effect that ketamine can have at low doses, where it seems to allow us to make contact with certain experiences, both physiological and emotional, that previously we had dissociated because they were too much. And so in a ketamine session, that can look like certain sensations starting to arise in the body, maybe tension around the heart, or tension in the forehead, or contraction in the guts, or tingling or movement. I mean, there are all sorts of different sensations that can come up. And we take a somatic or body based approach to the work. And so, really support clients in opening to whatever is showing up in their body. And we also offer therapeutic touch work. And so that can look everything from just supportive touch, where someone is offering a hand to hold, or a hand on the shoulder or on the forehead, or focus touch, which can involve the therapist placing a hand somewhere on the client's body where they're experiencing those sensations, the tension in the chest or contraction in their forehead or whatever it is. And that can help bring the client's awareness to the sensations that are happening in their body, breathe into that area, and start to open up to whatever communication is wanting to come forward. And I've really noticed after many years doing this work that not just ketamine therapy, but also psychotherapy in general, that the body holds so much for us that we often aren't aware of and don't listen to. And so when we start to open up to receiving its messages, there's a lot that can come forward. And it can come forward in lots of different ways, either through just emotion coming through, tears, grief, anger, joy. All of the feelings are apt to come through there. Or it can come through images or thoughts or memories. And so we're really just supporting people in opening to whatever is showing up and working with it. Sometimes its meaning isn't obvious right away. And so we need to help people to unpack it and start to make the connections there.
Yeah. And we kind of spoke about this when we were first getting to know each other about like, essentially patients giving their consent for this kind of touch work prior to the session to make sure that everyone's on the same page about the kind of touch that they're going to be receiving and when. And so, I want to kind of name that in case people are like, well, they're touching them. What's go? But like they have consented to this
Absolutely.
prior.
Yeah. Thanks for naming that. The consent for touch is such an important part of the process. And it is, we dedicate a significant chunk of a preparation session to exploring with people their relationship to touch, any history of trauma around touch or their bodies, and what kind of touch they may or may not be open to. And so we never assume that this is something that people want. We always ask prior to taking the ketamine whether it's something that they would like to engage in. And if so, then we think together about where they're comfortable being touched, what kind of touch might be helpful. And we even practice the helping the client to identify what they want in the moment, practice asking for it, practice saying no, practice ending it, so that there's an ability to really clearly consent. A lot of us are not trained to understand, first of all, what we want and don't want, much less to say that out loud. And we're also often not trained to say no. Instead, we're conditioned to appease others or to do what we think others want of us. And so just this process of talking about consent for touch can be incredibly therapeutic in and of itself.
Yeah, and I think like you kind of when you were talking about the reassociative piece here about like, okay, if there was past trauma, like say there was kind of like sexual trauma in the past, I'm sure that
Mm.
there are a lot of things that come up for people in the way that they're connecting or feeling disconnected to their bodies. Like what I guess has come up for people that you like a common thing that maybe comes up for people maybe in these sessions? And how do you go about kind of guiding them through making sure they feel comfortable and they're accessing what they need to for themselves for this journey?
Mm-hmm. Mm-hmm. Yeah. So I would say more often than not, these kinds of trauma, overwhelm, like just to say a little piece about trauma, the way that I understand it, when a traumatic experience happens to us, it overwhelms the system. It's only trauma if our system is overwhelmed by it. So the
Mm.
same experience might be traumatic for one person and not for another. And so the system is overwhelmed by its response to it. Too many emotions coming up simultaneously. The fight or flight response is activated and can't come back down. And in that case, then our psyche does something really intelligent, which is that it takes the overwhelming experience and dissociates it. Moves it out of consciousness, so that we're no longer overwhelmed by the experience and we can carry on and navigate the experience in the moment. And generally, ideally, we would then be able to make contact with that experience again and kind of shake it off the way that you see animals after, an encounter with a predator, for example, shaking off their bodily response to what happened. Unfortunately, as humans, we often don't do that, or we end up in situations where the thing that induced the trauma is there chronically or consistently. And so we're not able to shake it off. And so instead it ends up living in our bodies in this kind of dissociated aspect of our psyche body connection. And it's only through these kinds of either trauma processing with or without medicines that we're able to come back to them and allow them to move through our bodies in a healthy way. So more often than not, these experiences come up and simply move through with a little bit of support. You most often see that happening through tears, but it can also happen through the body shaking. It's really common for the body to spontaneously start to move or shake. And sometimes it actually just comes through as memory, and the emotion may not be attached to it in the moment because of ketamine's dissociative influence. Sometimes people are in a state where they're not feeling in the moment, they're just regaining the memory. And then it's in the integration sessions where we process the emotion. So it can look a lot of different ways. Very occasionally, I've seen people be overwhelmed by the experience. It comes on and it's really big and strong. And so in that case, the therapist role is just to stay super grounded, be right there with the client, remind them where they are, and help them to come down from the experience. And that in and of itself, having a safe person there with you when you're overwhelmed can be the missing piece that didn't happen back, when the trauma happened. And so at this point, instead, you have a caring person who's right there with you. And that may have been what was needed.
If you've been waiting for a sign to finally try that new vibe you keep thinking about, this is it. Whether you're new to sex toys or you got a whole nightstand full of them, Lion's Den has something that can surprise and delight you, and maybe even unlock a new level of pleasure. They've been in the game for over 50 years, with 50 plus stores across the US, hundreds of trusted brands, and a knowledgeable staff that actually knows what they're talking about. And if you prefer to shop from home, their online store is stacked with options, plus discreet shipping and live customer support when you browse. From solo exploration to partner play, from curiosity to kink, Lion's Den is here to help you feel good, supported, and totally in control. Use code SEXEDWITHDB for 15% off at lionsden.com or in store. Prioritize your pleasure. You deserve it. Do you get awful period cramps like I do? You are not alone. About 30% of menstruating people experience pain so severe it disrupts their daily lives, and yet we still know shockingly little about where that pain comes from or how to treat it. On the podcast Cramped, my friend and host Kate Helen Downey shares her story of living with death cramps for over 20 years. Pain so intense it sent her to the ER, made her pass out, and left her with no answers. Until now. And I just have to say, this podcast is incredible. It is so well done. It's smart, it's powerful, and it's honestly very long overdue. In season 1, Kate finally got a diagnosis, a treatment plan, and real clarity about the science behind period pain. Now in season 1.5, she's answering listeners' questions and talking to the experts we all should have access to. If you've ever felt dismissed, misdiagnosed, or just incredibly over being told to, quote, just take Advil, Cramped is the podcast for you. Listen to Cramped wherever you get your podcasts. I'm wondering if we can talk about pleasure for a second, because I'd love to talk about some experiences that you've seen where people get more in their bodies and like talk about joy or happiness or pleasure, or talk about sexual experiences they've had, or if even after the experience of the ketamine assisted therapy in the session, they have kind of revelations about their pleasure.
Yeah. So for some people, one thing that's really sweet to witness as a therapist is that for some people, what they need and the first place they go, and this often just happens unconsciously. It's not like they're directing themselves there or they know that they need it, but I've come to trust that there is a part of us that seems to know what we need for healing. And sometimes that's pleasure. That's experiences of joy and pleasure and happiness and lightness that maybe they haven't experienced in months or even years. So I even just recently with a new client, that's where she went for the entire first ketamine session. It was just reconnecting with her joy, laughing, being in her body, moving spontaneously, and just beaming pretty much the entire session. So at times it will, I think it has to do with shifting out of these habitual thought patterns and out of this depressed mood into something else. It can just be so relieving for some people. So that's one way that it can show up spontaneously, which is so fun to watch.
Mm-hmm.
Another thing that can happen is that people can, as I mentioned with the defenses softening, often our defenses are around our happiness, for example, or around our ability to experience pleasure, or around our ability to connect to our sexuality. We may have received messages growing up that, it's not okay to feel those things for one reason or another. And so with the defenses softening, sexual feelings can come up all of a sudden, or, a sense of just being alive can come up in a different way. And, through our work there, we hold sexuality with a lot of care. So on the one hand, we make really explicit we make it really explicit that we are not going to engage in any sexual activity with the client, that's not what we're doing here. But on the other hand, we let them know that sexual feelings are completely welcome. They're an important part of being human, and they can come up in these settings. And we support clients in experiencing those and, kind of expressing, being with whatever's there. So that can be very helpful for people who maybe have been blocked off from their eros for years. And another way that this can show up is that ketamine can, as I said before, it can open us up to both ourselves, but also to the people who we're with. And so these sessions, these 3-hour sessions, can be incredibly intimate. People can start to feel very connected to their therapist, very supported by their therapist, maybe, closer to this person than they've felt to most people in their lives. And on top of that, it opening us up to our sexual feelings that can sometimes initiate what's called erotic transference. And what I mean by that is basically erotic feelings coming up toward the therapist. And sometimes that's just one-sided from the client to the therapist, but sometimes that happens in both directions where the therapist is feeling those feelings as well. Now, this is a very delicate situation to navigate for the therapist because it's super important to maintain a clear boundary around the role that they're holding for the client and not to take advantage of the client's vulnerability or the power dynamic that's inherently there, but instead to hold a very safe container for the client while also making a lot of space for whatever feelings are there.
This is so fascinating to me, this idea of erotic countertransference, just because I feel like, yeah, like there's so much there, I imagine, that can happen internally if someone is talking to you for 3 hours and if there's attraction. Like, I'm sure this doesn't just happen, obviously, with ketamine assisted therapy. This is for all kinds of therapy, right?
That's
And
right.
all kinds of doctor patient relationships. Like,
Yes.
there are so many different times, I'm sure, where these things come up. But I think the difference with this is that the point of engaging with ketamine assisted therapy is so that the client can open up emotionally more and potentially access some of those sexual, erotic, intimate feelings just in general that might just be kind of placed on the person in the room.
Yes, exactly. And that's how we see it, is that, we're on some level, we're not special. I mean, we have this intimate relationship with them, but also we're kind of a placeholder, for their, probably their earliest relationships, and wherever that kind of dynamic of being able to love freely went wrong,
Mm.
and also their future partners or close friends who, at this point, they may not feel safe enough to bring those feelings towards. And so the therapeutic container is a very safe place to do that and to start to explore and express and allow these feelings that maybe haven't been allowed previously.
Yeah. Wow. This is so, so fascinating. And just like real. Like, this is
Yeah.
very like a real life of like what actually happens in these experiences. And I kind of want to transition now because you're really, and your team are really on the cutting edge of having clinicians facilitate ketamine assisted couples therapy, which I find so fascinating when we originally talked about this. And I'm curious, like, what does this look like? What are the three kind of different ways that you've seen, couples use ketamine in therapy? How can this be facilitated?
Yeah, I'm really excited about this too, both with ketamine and also with MDMA once it's legalized. And both in different ways can really help couples to break out of patterns. I mean, as I think everyone knows, one of the hardest things about being in deep, committed relationship to someone is that we start to push each other's buttons as it becomes more intimate. And then we get stuck in these patterns, these dynamics of, each person playing one role, and it can feel really hard to come out of them, or, conflicts where it's hard to see each other's perspective. And what we found is that ketamine can really kind of open that up and help people to soften to their partner, help people to have compassion, help people to open to their partner's perspective in a way that they hadn't before, and also just to kind of melt the blocks or the kind of guard that we can develop around people who consistently push our buttons, around our partners, which we often see happen in long-term relationships. So, yeah, there are three different ways that I know of that ketamine assisted couples therapy can happen. The first is pretty similar to what MDMA couples therapy looked like back in the day when it was legal. And it basically involves both members of the couple taking a light to moderate dose of ketamine so that they're still able to be in conversation and connect with each other and the therapist, and working on whatever their issues are, but from this new perspective. And so that can have all of the benefits that I just described, really. And it's nice because it's a way to really drop in and be with each other and talk about, kind of the stuck old topics from a new perspective. But it's also in a manageable amount of time. It's a 3-hour session, where when we're looking at MDMA, it's more like a 6 to 8 hour
Oh,
session. So
wow. Okay. Big
um,
difference.
so yeah. And then another possibility, and this is something that a colleague named Will Vanderveer developed and described at a conference that I attended. It involves one member of the couple taking a dose of ketamine at a time, and this time a slightly higher dose. So they're going inward, music is playing, they have eye shades on, while their partner literally holds them. So the partner, has them in their lap, their arms are wrapped around them, the partner leaning back against their chest and just kind of melting into them. And I have not tried this method, but I've heard that it can just be incredibly supportive for people to, as you're entering into higher dose ketamine sessions, there's a real surrender and, letting go of our typical kind of ego that helps us to navigate the world, and it's incredibly vulnerable. And so to trust your partner enough to kind of fall into them and have them hold you during that experience can really increase levels of trust in general and intimacy and connection.
Mm-hmm.
And then the last option would be for both members of the couple to take a higher dose of ketamine together with a therapist there supporting them. And in that case, so they're both going into these deeper
They're
states
both
of
melting.
consciousness. They're both melting. They're both going into a K-hole, but in a super safe environment. And often people report, like I mentioned before, this experience of being interconnected, of their consciousnesses merging. And so, having that kind of nearly mystical experience together can also be healing in a different way.
Wow. I mean, because this is amazing. Thank you for explaining that.
Mm-hmm.
Because you're kind of on the cutting edge of this, and some colleagues of yours also have like been doing this, but most recently, like I'm assuming it's the last few years. Um,
Mm-hmm.
what does it really look like in terms of how many couples you've worked with, and like what their experience has been doing this?
Yeah, yeah. So we haven't worked with a lot of couples at this point. We've had, I don't know, maybe a dozen or so come through our clinic. So really not that many. And it has tended to be very supportive for them to, open up past uh, issues, but in a way that they're able to process together and come out feeling more alive, more vibrant, more open to each other, more able to handle things when they come up in the future, and just kind of generally more loving and connected. It can also inspire a sort of creativity, like mutual creativity. I talked about the neuroplasticity and how it can open new connections within our brain. You can kind of see that happening in the couple as well, where suddenly they're having new ideas. They're able to imagine their future together in a different way. They're able to step into creative projects together.
Wow. So it really does change in some capacity, or it can change the way that couples are relating to each other. Because as you
Mm-hmm.
said, there are kind of these like set patterns that couples get, especially monogamous, especially straight couples who are in these kind of scripts who have been together for decades. And I think this is really interesting to me as a sex educator when it comes to sex and intimacy, because I think that a lot of people at one stage of their relationship or another can get very stuck, and it can become sexless, it can become intimacyless. And I
Mm-hmm.
wonder if something like this would really potentially help people because of the literal brain change that
Mm-hmm.
it is creating for people to become more joyful, more open, kind of less stressed, more connected to one another.
Mm-hmm. Yeah. Yeah, and I will say something that is, not from my professional experience, but it is something that I've heard and also read about, that ketamine can really open things up sexually for people as well. Not
Mm,
for everyone, but if you imagine all of these things we've been talking about in terms of breaking out of old habits and the defenses lowering, it can help people to reconnect to their sexuality and also reconnect to their partner, or reopen to their partner uh, through their sexual experiences.
wow, that's incredible. Um, our last question that we have here is, where do you kind of see this field going? Like, you and I kind of previously, when we were getting to know each other, talked about like sex workers, like if there are more kind of pleasure-based practices like that have to do with this field. Like, can you talk us through that a little bit?
Yeah, yeah. There are a few things that come to mind, especially as I consider pleasure and embodiment and where the field is going. One is a personal passion of mine, which is integrating ketamine and dance movement. And
Yes.
personally, it's been one of the most healing modalities for me, combining ketamine and cannabis actually as well, and dance movement has allowed me to reconnect with my body, to connect with things that have come up either from my past or just from the week that need to be processed and moved through. And my body just seems to know what to do with them, to move to the music, but also to move from somewhere inner more spontaneously. And it's allowed me to heal from so much,
Mm-hmm.
just I've been through a lot in these past number of years, opening a couple of businesses and writing a book and just a lot that,
You're
my
busy.
body has held. Yeah. And it's just been such an important tool for me. And I hope to, in the not too far future, start to offer groups to kind of group dance experiences to support people in having these in experiencing this kind of impact for themselves. So that's one piece. Another, and this is another place that we're just starting to explore at the clinic at Sage, is integrative ketamine assisted therapy, which involves ketamine assisted therapy, but with a body worker or an acupuncturist or a craniosacral practitioner. And so in this case, people can process things verbally, but there's also a lot of attention to being in the body, to receiving body work, perhaps in areas where people have identified that they hold stress or tension or trauma. Um, or with acupuncture or craniosacral, starting to open up the energetic pathways. And personally, I've done an acupuncture and ketamine session. I've done a couple of them, and they've been so profound for me in
Oh,
terms of unblocking areas where my energy was previously stuck. And I likely wouldn't have even known that this was happening, except that the ketamine seemed to sensitize me so that I could feel the energy moving in my body in a way that I can't typically do.
wow.
So I'm very excited about where that may go. And then lastly, I think, we've found ketamine to be so helpful in conjunction with therapeutic touch work. And so it makes me wonder about modalities like sexological body work, you know, touch work, but where there actually is space to work more directly with sexuality and the body's expression of sexuality. And of course, this would require a lot of care around consent, a lot of conversation there, real clear boundaries, etc. But I do think there's potential there as well.
Yeah, I mean, I think that, especially like when thinking about folks with disabilities and the way that they are able to access their pleasure with folks who do therapeutic sex work, essentially.
Mm-hmm.
Like thinking about it in this capacity, right? Like people ensuring that, everyone's on the same page around boundaries and touch, but even just thinking about like what it would be like for someone in a ketamine assisted therapy session to be using a sex toy on themselves, right? Like
Mm-hmm.
even if it was like there's maybe a barrier, maybe there's a little shade between the therapist and them. But I
Yeah.
think that there's something there around like being able to open yourself up metaphorically to pleasure in this
Yes.
way. And
Yes.
I'm curious. I'd be curious to chat down the line to see if that is ever like again handled with a lot of care and a lot of consent and boundaries prior to the session. But yeah, it's just such an interesting thing to me.
Absolutely. And one thing I'll add to that is that right now, after people have 3 sessions with their therapist in the office, they can then actually do at home sessions where the therapist supports them in preparation and integration, but they're having the ketamine experience on their own at home, just with a support person nearby who makes sure that they're safe. And that could be another way to do this in conjunction with traditional therapy, even where you talk about kind of the goals of reconnecting with sexuality and then have space in the privacy of their own home to be able to play with a sex toy or a vibrator or just touch themselves and start to reconnect, while also feeling very safe doing that.
Yeah. This has been so wonderful. I would love to just hear where people can find you and just like where people can learn more about ketamine assisted therapy if they are interested in doing it themselves or reading about it.
Great. Yeah. So you can find out about me and my clinic at our clinic's website, which is sageintegrativehealth.org. And on there, we have a whole page that's focused on ketamine assisted therapy with a lot of information there. We also have some resource links as well. Another place to really learn about ketamine is a website called KRIYA, KRIYA. A woman named Raquel Bennett put this together and is just chock full of resources about ketamine and ketamine assisted therapy and different research, etc. So that's a great place to go as well.
Amazing. Thank you so, so much for being here, Genesee. I really appreciate your insight and your expertise, and I learned so much, and I know our gorgeous listeners also did too. So thank you.
You're so welcome. It's been a real delight to talk with you, Danielle.
Hey, everyone. Welcome to the Afterglow. Talking to Genesee today made me realize how often we treat pleasure like a bonus prize instead of something essential to our happiness. The way that she described ketamine really softening our rigid edges, whether that's around joy, intimacy, sexuality, made me think about how much we miss this when we're stuck in the same thought patterns and loops. And sometimes you really do need something novel to kind of jolt you back into yourself and into your body. Her thing about practicing consent ahead of time also got me, not just a yes or no to a touch in session, but actually rehearsing those words so they're easier to say for the rest of your life and the rest of your time with partners. That is such a different way of relating to your body. Like saying to yourself, I'm allowed to notice what I want and name it without apology. I also can't stop thinking about her clients who just start laughing and moving and lighting up in the middle of a session. It kind of sounds like magic, like their bodies remembered how to feel good before their brains could catch up with them. That is the kind of pleasure that I want more of. Low stakes, no performance, just like being alive, this beautiful aliveness. So here is your pleasure practice of the week. Take yourself for a walk outside. It sounds very simple, but sometimes it feels really hard for us to do this. 15 minutes. Don't, look at your phone. Let your senses really kind of boss you around. Really follow like a smell or a sound or a texture that you want to see and see what tiny thing shifts in you. Thank you so much for listening. Love y'all. See you next week.